Masseter hypertrophy is a frequently asked operation these days. In fact, patients often seek it without even know that it's actually called Masseter hypertrophy. What is reported as masseter is usually the following. I have an egg-like lump in the corner of my chin. It spoils the structure of my face. I want to narrow my wide chin. People with such complaints, sometimes rather than the lump on the jaw corner, the patient comes with complaints like my jaw hurts, I grind my teeth at night, and so on. Now, this is what happens here. Sometimes the chewing muscle at the corner of the chin becomes thicker. It grows a muscle just in the corner of the chin. Under the ears, there's a bulge. Huge swelling like a small egg. Patient come to us and may have some teeth grinding, clenching at night, and pain in the jaw joint due to the squeezing. And this pain may reflect on the ears as well. Considering all of these, if the muscle has grown, it is called Masseter hypertrophy. Masseter hypertrophy gets the name from the muscle in there. Our chewing muscle in there is called masseter. Now, there are two problems faced if the chewing muscle is too thick. Firstly, it distorts the appearance of the face as the muscle grows. The face looks very wide. Secondly, it also thickens the bone. It also thickens the bone where it holds. There are two treatments for this. One is Botox. Botox is an outpatient procedure done in 5 minutes. We inject into the muscle with thicker needles. Normally, when we use Botox on the face, we do it with much thinner and short needles because it needs to be injected into the muscles right underneath the skin. But the Masseter hypertrophy is thick muscle. Since the muscle mass is bigger there, we do it with longer needles and we use higher doses. It is only done with a needle and it takes 5 minutes, but its effect is not permanent. It lasts for 6 months. Botox effects phase away after 6 months, and it also has no effect on the bone because Botox doesn't affect the thickening in the bone. Its effects last for a short time, not permanent, only for 6 months. It has no effect on the bone, and it is a non-surgical method. You don't get narcosis, there's no pain or aching. The second treatment for Masseter hypertrophy is a surgery. The effects of the surgery are, of course, permanent, but the recuperation period takes longer. The surgery is over 1 and 1.5 hours. It is a little bit more painful process, but if you are looking for permanent results, then the surgery is the solution. Also, another plus of surgery is that we file the bone during the operation, so it's possible to thin the bone as well. How do we perform this surgery? Under narcosis. And we give narcosis through the nose, like we do in intraoral surgeries. It would be easier for us if the inside of the mouth is empty. We enter from the point where the cheek and bone meet inside the mouth and separate the muscle from the bone. Just where we enter, there's a bone there and the muscle on the outside. What then is surgery is cut slice from the muscle to thin down the muscle. We take a flare-like piece out and it becomes thinner. We stop the bleeding. Then we file the bone. We have special rasps for this, very sharp. We file the bone. We make it thinner. Then we check for the bleeding, leave it in place and stitch through the mouth. At the end of the operation, we put a bandage or a corset pressing firmly on the chin, running around the top of the head. If the patient uses a corset, we ask him or her to keep using it for a week. If you are doing flanges instead of corset, we just want the patient to hold it for 2 or 3 days. Now it also takes long for the results of this surgery to settle. Why? Because this is not an traumatic surgery. In other words, there are surgeries where you don't damage the tissues, don't result in any bleeding that heal very quickly without any edema. No bleeding at all. This is not such an operation. It is exactly the opposite. It's a surgery that harms tissues. You need to know about that. Because we are taking out a piece of the body and filling the bone. There are things that damage the tissue, but it's the nature of the surgery. We need to do it like that for this operation. We need to minimize the muscle and file down the bone. Therefore, here the muscle will again hold on to the bone. And as a result of that trauma, There will be a too little much edema. After the surgery, the patient's chins will remain swollen for a while. Meaning like it was before the surgery but not an excessive swelling. Here the patient doesn't see the result. It takes months for the swelling to go down and the hardness there to soften. My advice for them is to be patient and wait for at least 5 to 6 months. They shouldn't say, here is the result before 6 months. Actually, we explain to these patients, but no matter how much we say, the patients even ask us sending a text and we text them back saying they need to be patient for 6 months. The patient comes back in about 1 or 2 months after the operation. They say, I didn't see the results. I didn't go down yet. I mean, we mentioned this to the patients before, but there is this. The patient experiences memory loss. They completely forget what you said before and act as if you never said this. Like I said, this is a traumatic surgery. It's a surgery that damages the bone and the muscle. It is the way it is. Since we want to make it smaller, we file the bone and extract parts from the muscle. It takes a long time to heal. There is hardness and swelling. It does not swell more than before the operation. But the patient says, I cannot see the results. That's why you have to be patient. We cannot say that we have seen results before the hardness there goes soft. The inflammation there will also pass. Again, the muscle tissue will stick to the bone, right from the scratch. The sticking there means progress. The healing tissue should also soften. So you have to wait. If you are going to have this surgery, please be patient. Let me be clear to you, very clear. Most of the plastic surgeons in the market don't want to perform this surgery. Here's why. The patient comes back a month later, 2 months later, gives you a headache. They don't patiently wait and so on. Honestly, I say it very clearly from the beginning, like 50 times, 100 times. You just look at how many times I repeated here. You must be patient. The inflammation in the jaw corner and the sticking of the muscles there to the bone, the whole healing process should be completed. The tissue here needs to soften. It needs to regain its former elasticity. Then you will see the results. That area will become smaller as the edema. The hardness and the inflammation pass. Because that what's done in the surgery is removing the muscle. We are reducing your muscle tissue and we are also rasping the bone. If you come without waiting for this result a month later, saying that it didn't work, I don't like it, then there's nothing to do. You must wait. Other than that, there's nothing else to say. Generally, it's not a complicated surgery, meaning you wouldn't face any problems. The stitches inside the mouth that self-melting, so there is no need to take them out. As I said, there's the matter of the bandage. If you say, I'll wear the corset, perfect. It'll make the swelling low. We give the patients a special corset that presses down the cheeks, coming through here. We give this after the surgery. If you wear it for a week, then it's great. Other than that, there's nothing special about it. We are going to give you antibiotics, painkillers, and a mouthwash. It is required to use the mouthwash since there are stitches inside the mouth. Don't eat any solid food till 1 day following the operation. Eating soup, yogurt, fruit juice for a day for 24 hours. That would be enough. Then we can move on to normal solid food. This is what I did with my patients up until now. And I had no trouble at all. What else can I tell you? Let me take a look at my website. If there's anything that I missed out, we file down the bone, Botox and all. Like I said, that's it. I don't have anything else coming into my mind. If there's anything else you want to ask, you can send me an email. My email address is on my website. You can also text me on WhatsApp.